Hello, my name is Marta Latasiewicz. I'm one of the new consultants who recently joined the team, and I must admit it is a real pleasure and privilege to be working here. My talk will be about what is AMD. I am very aware that many of our patients are very well educated about their condition and might find the talk too basic, but at least I hope you will enjoy the artwork on the slides. So I will explain what is AMD, its symptoms, how we diagnose it, the types of AMD and the treatment options. AMD stands for age-related macular degeneration, which translates into wear and tear of the macula caused by aging. The macula is a part of the eye, and I will explain in a moment a bit more about this. By definition, AMD first affects people over 50 years old, and it is the #1 cause of low vision in the UK. The macula is the central part of the retina. The retina is a bit like the film in a traditional camera. It lines the inside of the eyeball like wallpaper and contains photoreceptors responsible for vision. The central part of the retina is the macula and is responsible for precise vision, like reading. So, wear and tear of the macula can impair the central vision, but it doesn't affect the periphery or the edges of the vision. It does not cause total blindness, but it can make activities such as reading, watching television, recognizing faces difficult. We don't know the exact cause, but there is a strong link to family history of AMD, smoking, and having high blood pressure. As mentioned earlier, AMD affects the middle part of the vision. You can get it in one eye or both eyes, and having AMD in one eye does increase the risk of having it in the other eye. The first symptom is usually a blurred or distorted area in your vision. But it can also cause you to see straight lines as wavy, objects looking smaller than normal, colors seeming more faded, and even seeing things that are not there. But AMD isn't painful, and it doesn't cause a change in the aspect of your eyes. Sometimes AMD can be found on a routine eye test without even having the symptoms. We diagnose it after an exam of the back of the eye and an OCT scan, which is a cross-section of the macula. It can be also confirmed by an angiogram. It is a special test when we take photos of the back of the eye after putting a fluorescent dye in the vein. There are basically two kinds of AMD, the dry kind and the wet kind. The dry kind is more common and generally tends to get worse very slowly over several years, whereas the wet kind can get worse very quickly, within days or weeks. A healthy macula has all the layers of the retina intact. In dry AMD, there is a buildup of fatty waste, metabolic waste, underneath the retina, which we call drusen. Dry AMD can also present as atrophy or thinning of the retina. Dry AMD can occasionally turn into wet AMD. Wet AMD, also called neovascular or exudative AMD, is caused by pathological or bad new vessels forming underneath the macula, and they can bleed or leak into the macula. In non-treated or very advanced stages of wet AMD, a scar can form in the central part of the vision. The treatment of AMD depends on the type of AMD. Unfortunately, we do not have any special treatment for dry AMD, but certain vision aids can help reduce the effect on a patient's life and help with the daily activities. In wet AMD, patients may need regular injections of a medication in their eye, and very occasionally a light treatment called photodynamic therapy can be used to help stop the vision from getting worse. The injections that we use in AMD are given directly into the eye. The available medications help stop the bad new vessels from bleeding or leaking into the macula. This kind of treatment stops the vision from getting worse in 9 out of 10 people and can improve the vision in 3 out of 10 people. But this is only a treatment, not a cure. So we carry on with the treatment so long as we can maintain the vision and the macula stable or dry. However, there are different new treatments on the horizon, such as longer-acting medications, thanks to which patients might require fewer injections, newer methods of delivering the drug into the eye, and also medications and treatments that target different causes of AMD, including gene therapy or stem cell treatments. We hope to have this available for our patients soon. I hope you enjoyed this presentation. Thank you.